Otolaryngology, which is quite a mouthful, or ear, nose, and throat medicine, really encompasses anything that relates to disorders of your ear, including hearing loss, ear infections in children, malformations of your hearing bones, anything that prevents you from using your hearing really well. Similarly, the nose part, or the N, incorporates breathing through your nose, allergies, sinus disease, tumors or cancers that can grow inside your nasal passages. And then throat is really broad, so a lot of people feel like maybe it relates to the tonsils. They often see us for sore throats, but it's a lot more than that. It's any disorder of your tongue, your lips, your throat cavity, and then also any disorders of your thyroid or any lumps or bumps that grow on your neck that we can biopsy. And if you do end up, unfortunately, with having some type of cancer, we can also get that removed and send you for further treatment. So I think most people don't realize, but it's super broad what an ear, nose, and throat physician sees in terms of the area on the head and neck, but also in terms of ages, because it can be from a little child to an older adult that loses hearing.
The people taking care of you care more about you than at any institution I've ever been at. The mission is here. People hearts are in the right places. People really care about patients and their outcomes. So I think if you're coming to CHA, you're getting cared by family.
One of the things that I tell people about why I love working here is that we really care about our patients. And a lot of times the nurses, the providers, the staff, our physician assistants actually get to know the patients really well. And the reason for that is you're not just coming to a surgery clinic where it's in and out and you're having a body part fixed and you leave. Our number one goal when we see you as a patient is to try to prevent your need for surgery. A lot of things can be treated with medicines or testing, and we always go through that route first, and we do it with you.
I would say that maybe 10%, and I would underline maybe 10% of patients that we see actually undergo surgery. If you come to CHA for your surgical care, you're going to have surgeons who are highly skilled and care greatly about your care and your outcomes, and you'll be very happy that you were cared by our providers.
Getting people over that fear, if they've talked to people that have had these surgeries years ago, it often is very scary when they come to see us. And a lot of what we try to do is dispel the myths around, if you need to have an ear, nose, and throat surgery, our technologic advancements and the stuff that we now have at CHA really allows you to miss a minimum amount of work and also be comfortable in your recovery at home.
I would say you would come to CHA because we treat you as a person. We treat you with compassion. You should feel very, very comfortable by the teams that are taking care of you, the surgeons that are taking care of you, and know that you're in excellent hands.